Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. Welcome to Perspective with me, Julie Ali. And on the show today we have Dr. Feher. He is a doctor and he's also a physiotherapist. Quite interesting background. He and I have been talking off air, and I'm quite fascinated by the type of work he's been involved in. We are going to talk physiotherapy simply because in the month of November is World Day of Remembrance for road traffic victims. We may not specifically concentrate on road traffic victims. We'll talk about physiotherapy on a broad scale. We'll talk about aches and pains, how often you should see a physiotherapist, what type of exercises or therapies you should be doing at home. All of that and much, much more on the show. We do hope you're going to keep us company throughout this hour on Perspective. Very good morning. Welcome to the program.
Good morning.
Nice to have you here, and hopefully we'll bust a few myths regarding physiotherapy and also highlight the facts about physiotherapy. And of course, in keeping with road traffic victims, it's going to be the World Day of Remembrance is going to be observed sometime in November. In your work, the many years of practice that you've been in, did you deal mainly with road traffic victims or any and every type of an injury or an ache and a pain as far as physiotherapy is concerned?
To answer your question, over the last 2 decades, we have dealt with specifically neurological and orthopedic conditions in and out of hospitals. So inside the ICU, inside the high care, inside the wards, and inside of the outpatient department, where I would say a large percentage of these people at some point were road accident or traffic victims.
How serious and how traumatic are those type of injuries, and when you're having to deal with them, are you actually in the operating theatre as well whilst their limbs are being mended, their broken fractures are being attended to, or do you see them post the operation?
The surgeons will see them in theatre. As physiotherapists, we don't have anything to do with the in-theatre. However, if the person is admitted into the hospital before they get operated on, if an operation is necessary, often they will have life-threatening conditions where you have to do chest physiotherapy. You have to often suction fluids like phlegm or spit or blood or different combinations of these from the airways of these patients while they are ventilated, being kept alive with a ventilator before the operation and sometimes after the operation. So that will be the ICU sort of work. When the person comes out of the surgery or doesn't need surgery, we are involved in the rehabilitation of movement and of sort of social cohesion and emotional cohesion to try and get the person functional again. And that will happen in the realm of a hospital unit. And then obviously the continuum goes forward into outpatient therapy and into home care and integration into the community.
Gosh, I didn't realize that your work involved so much of one-on-one interaction with the patient. And of course, it is very important, is it not? Because you want a whole person to leave that hospital or with ongoing therapy. They're going to form a relationship with you, a bond with you. And I guess that's where biopsychosocial, spiritual issues come in. There's a special model that has been formulated a while ago and is now recognized by the medical council, the medical departments, different medical practitioners. Are medical practitioners actually attuned with all of this? Are they practicing it? What exactly does it mean?
Julie, I think that's great that you've shone a light on that. I think a lot of practitioners these days try their best to practice that, and we encourage it. Historically, I think medicine or healthcare looked at treating these patients, maybe let's talk about the road accident victims, biomedically. We would use them as a biological being, like a machine, and we would put them back together again like a machine, like a Lego piece, and off you go. But the model of healthcare we are taught at university, and the books explain it thoroughly, but putting it to practice is also quite challenging often, is a biopsychosocial spiritual model. Now what that means is we try and enable or heal the body, that's the biological, and then there's a psychological element, that's the psycho part. Then there's the social part. We have to still make this person cope with their family again, their work colleagues, community at large. And we must recognize that, you know, human beings are spiritual and or religious, and that gives you the care on the spiritual aspect. So that is defined as a model, the biopsychosocial spiritual model of care. And I think in healthcare, that's what we try to perfect, and we have been trying to perfect it for a long time. And those of us who are aware of it, try a bit harder.
Those of us who are aware of it, why is the general healthcare professional not aware of it? And if they are and not practicing it, how does it disadvantage the patient?
Well, that's a great question. I think academically most are aware of it. I mean, if you're inundated with textbooks of learning as you learn pathology and orthopedics and psychology and neurology, etc. This is a thin sliver. You know, if you think back to your schooling, you learned some things which were maybe one page or one paragraph long ago, and then over time they become a compendium of information. I think time and the economy is a great pressure on all of us, and each healthcare practitioner or physiotherapist in this case are under pressure to do physical things, and they will do physical things with that patient and quickly move on to the next patient and then the next patient, because the need, as we know in this country, is enormous. But if you view the patient as someone who doesn't only have physical needs, but also has psychological needs and social needs and spiritual needs, you should be able to attend to these things as well, but it is a challenge.
Talk to me about how you interact with your patients, because I know a patient of yours who seems to have this great rapport with you, this great connection with you. And that's the reason why you're sitting here, because they couldn't stop talking enough about you and said, please, you've got to interview him. Not only will he talk to you about physiotherapy, but just him being a human being and the interest he takes in his patients. Now, we're not going to knock the healthcare profession here, but we do know there are certain practitioners who just do not connect with their patients. I've been to a couple of practitioners for different reasons, for different, medical issues. And after my visit or my consultation, I vowed never to go back to that person because he or she was so cold and clinical and treated me like I didn't feel, I went in there not feeling well physically, mentally, but I left that interaction feeling even worse because I felt like I didn't matter to the medical practitioner. I'm sure you've come across a lot of that in your practice.
I suppose it boils down to your ontology or your epistemology, which is defined as your theory of knowledge. And I think my epistemology is I was blessed or lucky enough to view human beings as holistic beings that are not just a body, but a connection that is psychological with themselves and with others, and socially, and then spiritually we have our beliefs, which I think should unite us. So it was my theory of knowledge that allowed it to be, and it is not unique. It's supported in the literature, and you'll see it amongst people if you look for it.
Okay, I'm going to pick up right after the ad break.
Okay.
Richard Feher is my guest. He's a doctor and he's also a psychologist. He's been running his practice for a very, very long time, but he's also said to me off air that he's kind of stepped back from physiotherapy. We're going to find out why and talk more about physiotherapy a little later on after the break. Welcome back. A point of correction. I did refer to my guest as a psychologist. That's incorrect. He's actually a physiotherapist and he holds a doctorate as well. We're going to ask him about that as well, and why initially did he have an interest in physiotherapy. Welcome back, and would you like to respond to that?
Sure. The response would be, thank you for correcting it. I'm a physiotherapist with a master's degree in physiotherapy, and I have a PhD in healthcare.
Wow. And why have you stepped back from physiotherapy? What other interests is keeping you busy now that you've had to step back? And let me also put another question to you. I understand there are different specialities within physiotherapy, and at the beginning of the show, in our first segment, we spoke about you working with road accident victims. How is that different from other modalities within physiotherapy? So I have thrown a lot at you.
Sure. Let me try and make sense of it, and you can guide me along. Stepping back, I'm not very young anymore. I'm in my 50s, and I had a stroke several years ago, which I am still recovering from, and there are certain challenges with that, and physiotherapy is a very difficult and a hard profession and very valuable profession, and the amount of stress and strain that is probably upon me, it allows me now just to enter and integrate to a smaller degree now than I used to. So that would be the reason that I'm stepping back, as you put it. It's for health reasons. I'm
sorry to hear about the stroke. I do hope you're making progress in your healing. You do look a picture of perfect health, I might add. Sure. So obviously whatever you're doing is working. I asked about the different specialities or modalities within physiotherapy, and just pre your stroke, did you kind of get signals within your body, from the universe, physically, mentally, spiritually, that something's not right here?
If stress has anything to do with anything, at the time I was still completing my PhD. I was doing ultra marathons like the Comrades Marathon and the Cape Epic. I had 2 small children under the age of 5. I was running 2 national charities. I had 3 physiotherapy practices that I owned, and another business that I was busy with. And I think that was enough for a 45-year-old man. I was pushed to the brink, and lack of sleep, too much input, and I think my body retaliated and I had a stroke.
Being a physiotherapist yourself, being in the medical fraternity for a very long time, having dealt with road accident victims who were near death, and in your work helped their rehabilitation, did that help you at all in your recovery? What were, apart from your medical team helping you recover from your stroke, what were the key things that helped you in your recovery, and ironically, you come from a physiotherapy background, and then you were, affected by a stroke. Did you have issues around mobility yourself?
I did, and I couldn't speak. I couldn't find words. I was aphasic and apraxic, so I couldn't have this conversation 5 years ago.
Sure.
So I was really a very disabled person, and it's taken me a lot of time to recover. And thanks to a biopsychosocial spiritual method of very good doctors and very good therapists and my faith intervening together, I am recovering well and have recovered well. Back to your question about the road accident victims, I don't think that work, it's almost independent.
Totally unrelated.
I've answered that question around my recovery, but for these other patients, they come with a variety of different problems, and we can speak about that later if you'd like. Sure. I think, and we are trained and to help people with these problems, and we can list what they are, and at the same time, our empirical nature of attending to problem solving on a daily basis, on an hourly basis, on a minutely basis with patients, we have to iterate new solutions depending on how the person presents with their pathology.
I hope you don't mind me asking these personal questions about your condition, your stroke, your recovery. Do you believe that having been a practicing physiotherapist helped you along the way? Because whatever instructions and guidance you were getting from your medical team made sense to you because you do have a medical background. Do you believe that that helped you along?
Undoubtedly helped me. Undoubtedly helped me. I still am in charge of the neurosurgical physiotherapy at the Olivedale Hospital.
Wow.
And if I hadn't dealt with lots of patients who had brain tumors, strokes, and were victims of brain injury from motor vehicle accidents, I wouldn't have recognized what was wrong and wouldn't be able to categorize my work around myself as well.
How long did your recovery take? How long is it before I see this picture of perfect health sitting here in front of me?
Don't believe everything you see is the first thing I'll say, or don't judge a book by its cover. I'm still recovering.
Please God, may it go well for you.
Thank you.
In the least possible time, because
Thank you.
I believe you still have lots to share with our fellow human beings.
Thank you.
You are still practicing, but
I am.
Minimally.
Well,
is it because of your condition?
It's purely because of my stroke.
Okay. What else do you do to keep your mind active? Because you have, obviously, you've got a doctorate and you've done so much of great work in your field. I come back to the couple who spoke so very highly of you. I'll just mention the name, the shortened name, and that is Zweli. I think as far as he's concerned and his recovery is concerned, you were the godsend. If you hadn't been in his life helping him rehabilitate, he kind of said to me that he doesn't think he would have made this recovery up to now.
That's very kind of Zweli. I remember him as a patient fondly and vividly, and he was difficult to treat because he had so much wrong. He was very lucky to escape with his life, not just once, but subsequently when he had infections, which were the life-threatening, and he had trauma, which I will only mention if you bring it up, to various parts of the body. I will talk about him in third person when we speak about other people and their injuries. He had so much happen to him, so much wrong, that how he was able to recover to still be this great guy who today can still attempt to help so many other people, which he is doing currently. I'm just so proud of him. He's a good man, and I think he has a lot of good still to share with us.
We're going to talk about the different types of car accident injuries. We're going to talk about the disabilities, how people can then, together with their support team like yourself, like a physiotherapist and other mental health professionals, how that helps them get better. But let's talk about the impact on the families and the role they play in the recovery of their loved ones.
Okay, that's a valid point that I think a lot of people negate. One of them is the caregiver burden. So when people are taking care of the victim, we'll call it the victim in this case, it then takes them away from what they were doing. It can often be children caring for their parents where they should be at school or at university. Or it can be the husband or the wife or the parents caring for the other family member, takes them away from their work or their other responsibilities. And the burden on these people is enormous. It's enormous psychologically. We know that it troubles them so much that they often are left academically, psychologically worse off than the victim themselves. And there's a financial loss too, where you see these people who then aren't fiscally active, and then they can't bring in the adequate finances for their family. Or what we see in the literature is that they often have to sell off their assets, things like houses and cars and other investments, to help the victim in this instance.
Huge impact on the family structure, and I have no doubt in my mind that in certain cases, as much as they love the victim, the car accident or the stroke victim or whatever, resentment can set in. But hold that thought, we've got to go for an ad break and we will be back in a minute or two. Dr. Richard is my guest. He is a physiotherapist and he's so much more. We're going to continue the discussion right after. Welcome back. Richard Feher is my guest. He is a physiotherapist. We're talking about car accident injuries. Don't forget that in November we do remember road traffic accident victims, and they can be pretty horrific. Very horrific indeed. I should imagine you as support medical staff post the operation or whatever have you can become quite affected, traumatized when you see the state the victims are in. And then you're having to work with them and you're having to help heal them as well.
You know, let's talk about the kind of things that physiotherapists and surgeons and physicians, occupational therapists, psychologists and nurses, case managers in the hospital will see with road accident victims. And there's a wide array of accidents and injuries that may happen. You know, these victims might be hit while they're walking, they might be in a vehicle, they might be thrown out of a vehicle. Obviously, I think the worst of these is death, to lose one's life. That would be the most traumatic. Then I think the things that are typically seen are starting from the top, head and brain injuries. For example, you can have a concussion, which is a smaller brain injury with light bruising of the brain, which leaves you with symptoms that impair your cognitive, mental function and emotional function and physical function, to much more severe injuries where there's diffuse axonal injury, where the nerves in the brain are actually severed or traumatized. Then the function of the brain can't execute the functions that are required of the person. There can be even worse incidences where there's a sort of a bleed, a hemorrhage inside of the brain, which then occupies that limited space, putting more pressure on the brain. You can have small strokes, or you can have things like traumatic brain injury, where depending on which part of the brain and which function, because each part of the brain has different functions, depending on which part of the brain is damaged, results in impaired functions for the person. Following that, spinal cord, the nervous system of the body. If the spinal cord is damaged, you can have a variety of injuries, notwithstanding paralysis, either one side of the body or both limbs or all four limbs, or portions of the nervous system, which is very difficult. Then you can have limb injuries, where typically we see in these accidents where the femur, the thigh bone, hits the front of the car or the dashboard and acts as a long nail and gets hammered out the back of the pelvis. So it smashes your pelvis. Your ribs often break, causing trauma to your organs, which the ribs are the protection for the organs. Often the shoulders will dislocate or smash because they are also being driven back by the steering wheel or the seat in front or something like that. And in some cases I've seen traumatic amputations where a limb actually gets almost severed off and then has to be cut off afterwards, and that leaves its own set of very, very traumatic outcomes. For example, someone who I've treated unfortunately had to have their limb amputated, and they're left with something called phantom limb pain, where the brain still perceives the limb is still attached, but it's not, and it results in extreme pain for the thing that isn't there anymore. And this comes with its own milieu of psychological and social and physical complications.
So in instances like that, when you were practicing full-time, what sort of physiotherapy would the patient then need? So if a limb is amputated, is there still a role for physiotherapists to work with that patient, and what would that type of therapy look like?
It's a very important role of physiotherapy. Look, you try and enable them with as much function as they can have with the remainder of their body, so that they remain functional in society, which helps them psychologically, socially, and biologically. It also, we know this, that certain kinds of exercise release drugs within the human body which suppress pain and make the person feel better and help the healing. So physiotherapy is fundamental to that sort of recovery, and that pain is true pain. It's called neuropathic pain because it is pain not just to the muscles, ligaments, and skin, but to the nervous system.
So let's take that very same person who's had a limb amputated, and over time, once they've healed sufficiently, they have a prosthesis, right? Do you still have a role as a physiotherapist where there is an artificial arm or a leg or a hand or whatever? Do physiotherapists have a role then in assisting this patient?
It depends on the patient. So it's iterative, and it depends on their needs on the day. Some people may or may not have an artificial limb. However, because the body has now changed, it will never fully feel normal again. And where the limb was, they will have varying degrees of difficulty. Plus, the rest of the body is now changing to adapt that. If you can imagine, your arm might weigh 5 kilograms. Now you don't have 5 kilograms on one side, so you will lean to the other side, and your legs will compensate with that. and so will your neck, etc., etc. Or you may, because of the pain, start to exercise less, and because you exercise less, you start getting fatter or weaker or unhappier. There's a myriad of complications that can happen, and physiotherapists should be armed with the knowledge to assist these people depending on what the disability requires.
Gosh, I never thought about it in that way. I never ever applied my mind to the fact that should you lose a limb, your body weight does change and you're going to start leaning to compensate, or, you know, it's just absolutely mind-boggling that there are people like yourselves out there to assist the patients, you know, in their journey of healing. And I guess, and I know you're not a psychologist, but psychologists would play a very important role in the healing of this person, together with physiotherapists and other medical care practitioners.
Absolutely.
Sure.
I think, you know, it again, taken on its merits, psychology, the social work, the homework, the spiritual work, and the biological work, the physical work, must work together for the full function of the person involved.
I should imagine with a very serious car accident victim that all of the different medical professionals would have discussions around the progress, initially what needs to be done, and then post-operation, you know, post-operation or whatever, you would work together as a team in the healing of this person.
I'm very lucky in the roles that I've worked in the hospital where I am. We have a strong multidisciplinary team. This is something that is sometimes often a luxury in various settings because of time pressures, economic pressures, etc. But this team works well where the nurses, the case managers, the therapists, the physicians and the surgeons combine nicely for the benefit of the person and potentially their family.
Medical professionals, doctors, nurses, yourself included, when you deal with a patient that's come out of a horrific car accident, and I know physiotherapists would see them post the operation when they need to start exercising again, surely it causes a lot of trauma to you guys as well.
I think it does. Some people are more affected by it than others. And I suppose one of your questions may be around how do you deal with things like that? And different people deal with them differently. You've seen how some professionals can go off the rails, so to speak. For myself, I rely on my family to relieve my stress, specifically my wife and children. And exercise for me is fundamental. My spiritual belief, my work, what's left, and books, and anything I can find to distract myself, possibly in a healthy manner.
Okay, let's go for our final ad break before we wrap up. Dr. Richard is my guest. We're talking physiotherapy, we're talking healing, we're talking about support systems in the medical fraternity. Please stay with us. We will be back with you for at least another 10 minutes or more. Richard Feher is my guest. He's a physiotherapist. We're talking physiotherapy and a whole host of other issues as well that has come up in the course of the conversation, and we do hope that you've gleaned some insights whilst we've been talking about physiotherapy and the role in healing, very especially for road accident victims. Richard, why did you decide to become a physiotherapist?
It's a very personal question, which a lot of people know the answer to, so I will share it with you. My my late mother and father. My father wanted me to be an engineer like him, and my mother wanted me to be a doctor. And when I was in high school, I was knocked off my motorcycle, and I almost died. My leg was virtually off my body. I had broken in 3 different places and was only really held together by skin on my body. I had to be flown to hospital in a helicopter to avoid me dying. And I was put back together again by surgeons. A friend of mine's father was a great surgeon, and he helped put me back together again. And it took me about a year to learn how to walk again. After that, my leg broke 2 more times. And I had
And the reason for that?
Because of the weak, I mean, my leg was just held. I was lucky not to lose the leg. So I was, and I had a great physiotherapist in hospital at the time when I was a schoolboy.
Can I just stop you there?
Sure.
You spoke about your leg then having 2 further breaks.
Yes.
And for the purposes of this interview, is that something common? So if someone comes in with a broken leg, and you know they're put together by the surgeon, they have a bit of physiotherapy or however the treatment plan works, is there a possibility that they, because of the leg being so weak, that you are at risk of further injuries or breaking the leg again?
Like all things we've discussed, there are varying degrees. If it's something very severe like mine was, where I was really held together by a piece of string, things can go wrong again and again and again, and unfortunately for me they did.
You were not too hard on yourself. I mean, earlier on you said to me that sport, you know, you're very interested in sport, etc. Do you not think that that was the reason why? Did you not push yourself too hard too quickly? And that again, I think would, you know, your answer would give people direction. People are watching us this morning and have similar questions on their minds.
There's a lot of insight in your question. So the second break happened for no reason. Once the metal work was taken out of my leg a year and a half later or a year later, where I had a lot of metal inside of me, soon after that, the leg just fell apart again.
Sure.
And then years later, or a little bit longer than that, when I was trying to learn how to run again, which was now years later, and given the context of that time of my life where all my friends were fantastic sportsmen and they were doing their best as being young men, and I was essentially hobbling around, and I was trying to learn how to run again, and as I was training to run, it just snapped, and I was actually left lying in the street with a broken leg.
Oh, no.
And I was calling out for cars to help me, and cars would just drive by. In fact, I had one car stop. Now I can laugh at it, but stopped, looked at me, and I pleaded with the person driving to take me to hospital, and they looked at me, frowned, and drove off. So
They probably thought you were drunk.
Well, I don't think they thought I was drunk. I think they I don't know what I can't think what they were thinking, but it wasn't very nice, and that was my personal journey. And so I implore people to be a bit kinder to each other. Back to the road accident victims, you know, my advice would be to be a bit kinder and more thoughtful to each other on the roads specifically. I mean, this show is filmed in Johannesburg. Just driving here was interesting, witnessing how unkind people are to each other. And I think just obey the law. If everyone obeyed the law, we would probably be a lot better off with fewer victims than we should be speaking about today.
You must have had a great physiotherapist who tended to you.
I did.
That made you decide, I want to help people in this way.
2 things. I had a great physiotherapist when I was a young man who helped me become viable again and functional again. And also I think I had life is a mystery. And why did I have this challenge and not another challenge? And I have had several challenges, and this is one of them. I think it's called me to help others, and so I've been able to help patients, and I can still help patients, whether it's in treatment or academically, with my research. And I suppose life calls us to do these things.
You have stepped back from your work as a physiotherapist. We do know that physiotherapists work hard physically, mentally, and emotionally, obviously. But you are trying to put back, to pay it forward through your research. Is it related to physiotherapy and healing of people?
Yes, it is. It's my research is on chronic pain, and I am intrigued and motivated to help people understand and acknowledge what makes up their picture, for better words, within their chronic pain situation. And I think if people can understand where they are and other people can understand them, because I think we misunderstand each other, we can probably help one another in life.
How far are you with your research? How's that going to better the condition of us as human beings? And also, how does one, I'm sure you've covered it or going to cover it in your research, how do you measure pain? I could say to you, I'm in chronic pain, and I may not be, I don't know. So how is that measurable, and how do we treat it then?
Well, that's a lovely question. The first thing is you ask the person, just ask them simply, what are you feeling? And one of the ways to measure pain is to measure it today, and for the last month, and how has it been for the last week. And you can measure it either with a row of faces, which is called the visual analog scale, from very sad faces to a delighted face, which feels no pain at all, or from 0 out of 10 being no pain whatsoever, to 10 out of 10 being the most pain imaginable. So you can ask these questions, and pain is a subjective experience, which is what you're getting at. However, drivers of pain are different. Some people have a psychological driver, some people have a physical driver, some people have a social driver. And what I mean by that is we know that pain is confused in the brain as anxiety, depression, and fear as well. So the more fearful a person is, and the more anxious or depressed a person is, the greater their level of pain. And often their pain is viewed externally as not being real, or being, in the old ways, people would call it psychosomatic. But it is driven by a psychological process that we do not fully understand yet, but we are starting to understand it. And that I think if you ask the right questions, which I have in my research and the research surrounding my research, we look at caring for people psychologically, socially, and physically.
I think because of the hectic lifestyles and the trauma we see around the world, and we've almost come to the end of the program, so very quickly we're seeing more and more people presenting, not only through accidents, but just going to a doctor and talking about chronic pain for whatever reason. How is that different from an accident victim to just someone like me walking in saying, "Doctor, I have pain in my head or my back or my whatever it is"? How is it treated differently?
Well, I think from a triage perspective, for an accident victim may die. So you have to triage what is urgent versus important. You are very important. But if you're going to make it to the end of the day, let's take care of the person who might die. So I think it's medical triage. If you can help the urgent victim first, and then later disseminate who needs your treatment later. But
the urgent and the younger victim first.
you have to triage everyone
Yes.
into what's urgent and important.
Okay.
We are all important, and I think that's also there's room for that to see what's important and rate that. It's a challenge, but we should face it together.
We've come to the end of the show. Very quickly, is there anything important you want to share with our viewers?
What I want to share is I would like people to be kinder to each other.
Thank you so much. I love that. Yes, we're living in a very harsh world, and kindness is what will heal us all. Dr. Richard, thank you indeed. It was wonderful talking to you.
Thank you very much.
God bless.
And you.
And that's where we leave it. Interesting physiotherapy, medical issues, and of course road accident victims. Please, let's be kinder to each other. Let's respect people on the roads, and if someone's trying to be silly and foolish by overtaking you, then let him have his way. No good wanting to overtake him and creating an accident and possibly losing a life in the process. Thank you for watching. As always, till the next time, Khuda Hafiz from me, Julie Ali.